And welcome back to Body Beautiful. I'm Janelle Marie. With us today we have plastic surgeon Dr. Joseph Mealy. We are talking about breast aug, breast implants, mommy makeovers, springtime. A lot of people are coming in. They've got to, get back in the bathing suit. They just had a baby. So there's a lot of people coming in for springtime. Here's the phone number if you want to call in for the doctor, 415-561-8753. And we'll post his phone number later on at the end of the show. All right, let's talk breast aug and tummy tuck. Can they be? Do they have to be done together? Can you do them separately? What's the deal?
Oh, no, they don't have to be done together. It's just nice to be able to combine the recovery into one recovery period.
Exactly.
Because with a tummy tuck, recovery can be a week or two, depending on what kind of activities we're getting back to. And with breast augmentation, usually it's a little bit less. So adding that doesn't really prolong the recovery. But it's spring, so it's mostly the body stuff that we're doing this time of year.
Really? And so what's the most popular,
for the, I don't know how many years in a row, breast augmentation has remained #1. It used to be that liposuction was. Liposuction still in second place. It's trying to catch up. But breast augmentation still remains the #1 procedure here in the U.S. for cosmetic procedures.
Now, I was thinking Cameron Diaz and Kate Hudson for some reason, because everybody's saying, oh, they had, breast aug, but they have very small breasts. Is there a breast aug that can be very small? I mean,
absolutely.
Oh, really?
The implants come from 100 cc's up to 800 cc's. So, yeah, the goal is always to find something that's appropriate. I try to listen very hard to what my patients are asking for, and I have patients that are A's that want to be B's. Yeah. And if they're going to be happy as a B, that's what I need to do. If I make them a D, they're not going to be very happy with me, and that's not going to help them. So
people can come in and say, I want to be a certain size, and they will be guaranteed that certain size? How does that work?
Well, I heard it put the best by one plastic surgeon in a meeting. Says if a patient wants to guarantee they want a certain size, I have to buy the bra. Oh, because every manufacturer is different. Some run a size small, some run the size big. So what we try and do is deal with pictures with the size of the implants. I'll have patients put on a bra the size they want to be, fill it full of like rice in a Ziploc bag, so that they can get the volume they want. Try it in their clothes, try it around town, so that there isn't that remorse where, oh, it's not big enough, it's too small. Want to be bigger, which is usually the case when we're replacing implants. Really? And also the opposite. I don't want to make them so big that their clothes don't fit and they're feeling uncomfortable. The goal is that people feel comfortable afterwards. Absolutely. Let's just talk, take everything bit by bit and talk recovery time. So if you're just going to do a tummy tuck, what's your recovery time? So the recovery time, it does vary by how much is going on. So with someone with a lot of laxity of their abdominal muscles where I have to tighten that more, it tends to be a little bit longer recovery. If I'm doing a mini tummy tuck, recovery is usually very quick. Like within a week, people are usually back to doing what they want to do. But it's variable. I have some patients, I do a full tummy tuck on, and I'm having to slow them down 2 days later because they feel fine. And there's other folks who, 2 weeks out are like, I'm not sure this was a good idea yet. Oh, no. But, once the pain goes away, then everyone's happy. And usually it's about a week or two. Not bad. Andrea from San Francisco, you were on the line. Andrea, you there?
Yes, I'm here.
What is your question for the doctor?
My question is, I had a recent breast reduction about 2 years ago, and I'm wondering if I can get a re-breast reduction because I have some hanging on the side. Okay. And then also I'd like to get a lift. Is it possible to get a breast reduction done again?
It is possible. It's not the most common thing we do. It tends to happen more often for women who are in their teens or early 20s who have a reduction, and then their breasts get larger with time. Over the course of 2 years, there probably has been some loss of volume because there's swelling right afterwards, and that may be giving you a little bit of extra skin. And it's really common to have that skin kind of extend over to the side. In order to fix that, it may mean making the incision that's under the breast a little bit longer in order to remove it. And there's always going to be a little bit of extra skin there because when we raise our arms, we need it. If we don't have it, then we can't raise our arms enough. Exactly. And that would be a problem.
And do people usually get 2 operations? Let's say they have a reduction, and then does it also sag so they have to get another one?
Not usually, no.
Oh, perfect.
No, but reductions can be redone. It's probably safest to have your original surgeon redo it because then they know where they left stuff. They know all about you. And there's going to be fewer complications. Wonderful. Well, we could talk about this all day, but unfortunately, we are out of time. I always love having you here, Dr. Joseph Mealy. Thank you. Now, if you want more information about the doctor, just call 925-943-6353. Check him out on the web, either drmealy.com or sanfranciscobreast.com. Thank you again, Dr. Mealy. This has been Body Beautiful. I'm Janelle Marie. Bye-bye. Have a great day.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.